there. My name is Aubrey and I'll be the nurse taking care of you today. Before we get started, is it okay if I confirm your name and date of birth, please? All right, thank you, Sally. And today I am here to perform your postpartum assessment. How about we get started with a set of vitals? So I'm going to start by getting your temperature, and I'm going to stick the thermometer right under your tongue. And can I have you hold your mouth closed until I get that reading? And let's say her temperature was 98.9, which is in the normal range. And at this point, I would not be concerned of infection. Next up, I'm going to count your pulse and count the respirations at the same time as I am counting her heart rate. So we can say that her respirations are 18 and her heart rate was 73. All right. Next up, Sally, I am going to assess your breasts. Are you feeling any pain, any tenderness, and are you breastfeeding? And how has that been going so well? Have you been able to latch? And with the breastfeeding, are you having any cracking of your nipples, any bleeding? Okay, if it's okay with you, I'm gonna have a look. I'm gonna lift your gown up, and I'm just going to palpate around. And do you feel any tenderness as I do this? Okay, there's no tenderness, and I am not feeling any warmth, any lumps or masses, and the breasts are soft as well. Next up, I'm going to put some gloves on, and I'm going to check your fundus, Sally, and I'm just going to remove this pillow from behind your head, and I'm going to remove this blanket back a little bit. I'm lifting your gown up, and I'm going to put a hand at the bottom, at the base of the fundus at the base of the uterus to prevent it from inverting when assessing the fundus. And then I am going to palpate near the top of the stomach to find the top of that fundus. All right, and Sally, I'm feeling your fundus midline, 2 fingers below the umbilicus, your belly button, and the fundus is boggy. So what that means is a massage could benefit that. It could also mean that you might need to void and urinate, and a way that you can decrease any of your bleeding after delivery is by doing that fundal massage. And I can show you where I felt that fundus. You can put your hand at the base of your stomach just like this and massage your fundus right there for 1 minute, and that will help to lessen that bleeding. And then next up, I would like to listen to your bowel sounds. I'm going to listen in all 4 quadrants. And then I'm going to sit her back up and listen to some heart and lung sounds. And could you take some deep breaths for me, please? All right, and you can breathe normally. Heart sounds were normal with no S3 or S4 heard. S1 and S2 were auscultated. And lung sounds were normal with no adventitious sounds, clear bilaterally, laterally and anteriorly. And now I'm going to lay you back down. And Sally, have you been able to have any bowel movements since you have delivered? Okay. Have you been able to pass any gas? No, okay. Well, one thing that could help you to relieve some of your symptoms of constipation would be to increase your fluid intake, drink plenty of water, and to increase your intake of fiber. So eat plenty of fruits and vegetables. And then, have you been able to urinate since delivering? Have you felt any pain, any burning? And then, have you noticed a foul odor of the urine? Okay. And one thing to be aware of is some signs of a urinary tract infection would include burning or pain when urinating, any frequency, or a foul odor to the urine. So if you start to notice any of those things, give your healthcare provider a call so we can see if you have a urinary tract infection. And then next up, I am going to look at your lochia to see if you have if you have a normal amount of bleeding. And then, when was the last time that your pad was changed? Her pad was changed 1 hour ago, so I'm going to check the pad, and I still have my gloves on, and her pad has a moderate amount of saturation. It is lochia rubra, which would be expected in the hospital right after delivery, and I do not notice any clots. I don't see any tissue, and I don't notice a foul odor, which would be abnormal. And then next up, I'm going to check the episiostomy. And Sally, have you had any tears when you delivered? She did not have any tears. So I'm checking for any redness, edema, ecchymoses, drainage, and wound approximation. And I am not seeing any redness, drainage, ecchymoses, edema, and the edges of the incision is well approximated, so we are not concerned of infection at this point. And I'm going to turn you over, Sally. And right now I'm checking and making sure if there is any hemorrhoids or not, and there are no hemorrhoids present. And then I'm going to go up the back and look for the site where she got her epidural or spinal inserted. And at that site, I am noticing no redness, no edema, ecchymoses, drainage, and that wound edge is well approximated as well. And Sally, one thing for you to remember, and it will help to monitor yourself for any signs of infection when you're looking at your wounds or looking at that spinal site in the mirror. If you're noticing any redness, edema, which is swelling, ecchymoses, or any drainage, or if those edges aren't closing up very well, you should give your healthcare provider a call because that might be a sign of infection. And then next up, I am going to check your legs for any signs of a clot. And are you feeling any pain in your legs right now? No? Okay, and then I'm just going to check both of the legs for any swelling, especially in the calves, and it would be alarming if it was on one side. I'm also looking for warmth and redness, and I am not noting that on either side of a leg. Sally, it is important to watch your legs and see if you notice any pain. If you start to notice pain, swelling, redness, warmth in one of your legs, it is very important to let your nurse or doctor know because you might have developed a clot. And a good way to prevent the development of those clots is by walking around as much as you can. And when you're just laying in bed, what's even helpful is just extending your leg and just moving around as much as you can in bed, just turning around and things like that. And that will help to prevent the development of clots. And the patient's emotion throughout the assessment was very cooperative. She seemed to be tired. She wasn't conversing very much, but was very cooperative. And if she were to have had a cesarean section, I would check her IV site so we can say it is in her right AC, and I would make sure that I could flush it, make sure the tube was patent, make sure that the temperature is within normal limits, and that there isn't any redness, and that it isn't causing the patient any pain, and that the tubing is running properly so that the patient can get all of her medication. I would also check the incision site, which would be in the abdominal area in the lower region. And I would expect most likely to see a transverse incision, and I would look for any redness, edema, ecchymoses, drainage, and to see how well those edges are approximated. And then lastly, I would check her Foley catheter to make sure that the tubing isn't kinked, that the bag is hanging below the bladder, and that the urethra isn't showing any signs of skin breakdown or irritation. And I would also check that the output, I would check the output that is in the urine bag to see what the color of it is, to see if there's any foul smelling odor, and just to check the amount as well. And Sally, do you have any questions for me? And I'll get you comfortable before I leave your room. Okay, well, if you have any more questions, don't be afraid to hit your call light. We're just one call away, and I will be back to check on you in a little bit. Thank you very much.